Good morning, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C. Today, I'm providing a very brief update on the district's response to COVID-19. Then I will ask the chief of police to provide a public safety update. I'm joined by Christy Whitfield, who is the director of the District Department of Small and Local Business, Neil Albert, who is the president and CEO of the Downtown DC Business Improvement District, and Christina Noel, the executive director of the Anacostia Business Improvement District, who will also talk about preparedness for phased reopening in the District of Columbia. This morning, we reported 109 new cases of COVID-19 in the district, bringing the number of cumulative confirmed cases to 8,334. And today, we report that no D.C. resident lost their life to COVID on May 25th. It's just a good thing. Thank you for that. So most of you know that over the weekend, we had a setback in our community spread metric. The data showed an increase outside of the expected ups and downs, so we had a reset day to day 11. And this morning, as we did yesterday, we were able to report decreases again. And so this morning that we reported that we are now at 13 days of sustained decline, which means that if the trend holds, we will be able to report 14 days of decline tomorrow. We, of course, track community spread to understand whether we are able to manage and rapidly respond to any new increases. And I want to be very clear that if we continue to follow, we will continue to follow the science and begin our phased reopening when the data suggests that we can. The health and safety of DC residents is our priority. We also continue to track how we're doing with healthcare capacity, our ability to test people, and to trace the contacts of those who have tested positive. In fact, today we are onboarding approximately 50 new contact tracers. We are also looking very closely at our testing sites, and starting next Monday, we will have 2 new sites. The drive-through and walk-through site will be established at 2241 Martin Luther King Avenue. This site is actually a replacement site, and it will replace our testing site at the United Medical Center. This new location was chosen as a more accessible alternative. Additionally, we are adding a new site, a new downtown walk-up testing site, and that will be established on 5th Street Northwest between F and G Streets near the Building Museum. Those new testing locations will begin operating on Monday, June the 1st. We also look ahead to next steps in phase 1. Last week, we asked our businesses to begin to get ready for a phased reopening. Phase 1 for restaurants would include dining outside dining. In phase 1 for retailers, non-essential retailers would include grab-and-go options. So we continue to ask them to look at coronavirus.dc.gov for a checklist for reopening. I'm very pleased also that DSLBD and our partners at the business improvement districts have made a partnership to use our local strategic supply to help businesses that are going to start a phase 1 reopening with some of the supplies that they need. We liken this to a one-time care package while they think about how they are procuring their own supplies. Some of those items you see on the pallet to my left, and they include hand sanitizer, masks, and cleaning supplies. So we're asking everybody to contact DSLBD or contact your local bid or Main Street to request one of these packages. Additionally, continue to look to coronavirus.dc.gov, where we will also put up a link on how to request one of these packages. We spoke to you previously about our building of a DC strategic supply. And that supply has, up until this point, been focused on how we take care of the government's needs and select private needs. And those select private needs have been healthcare workers. We've been focused on building the supply to make sure our first responders have all of the materials they need, our frontline workers in DC government, and essential workers, private sector essential workers. I asked my team in the Emergency Operations Center, as well as our GovOps team, to also begin sourcing supplies, PPE, soap, and hand sanitizer that could be used in our phased reopening for non-essential businesses. So this is some of those items. And even with tight supply chains around the world, we have been able to begin to build that stockpile. It's not unlimited. We view it as something that we can supply on a limited and one-time basis during phase 1. So tomorrow, we hope that the trends will continue, and we will be able to provide next steps on phase 1 opening to begin to be effective on this Friday, May the 29th. So with that, I want to turn to Chief Newsham to ask him to give us his situational update on public safety in the District of Columbia. We have gone through now the unofficial start of summer, Memorial Day weekend, albeit in pandemic, but still very focused on how we keep neighborhoods across Washington, D.C. safe. So with that, I want to turn to Chief Newsham. Then I will be available as well with our colleagues from DSLBD and our local bids for questions.
Okay, thank you, Mayor Bowser, and good morning. I am Peter Newsham. I'm the Chief of Police for the Metropolitan Police Department here in Washington, D.C. I want to thank Mayor Bowser and the members of district leadership who have been working at least 3 times as hard through this pandemic. I also want to thank the city's medical professionals and first responders that continue to work through our public health emergency. I'd be remiss if I didn't take a brief moment on the heels of this Memorial Day weekend to pause so we can honor and remember those service members who courageously gave their lives for our country. Today, we salute our fallen military and give thanks for their service and their sacrifice. Today is an opportunity for me to brief you all on crime trends and several incidents that occurred since this past Friday afternoon, including 4 homicides and a separate tragic shooting that appears accidental, but that's left a 4-year-old child fighting for her life. I'll begin on Friday, May 22nd. A little bit before 5 p.m., members of the 6th District responded to the 3000 block of East Capitol Street Northeast for the report of a shooting. When they arrived, they located an adult male unconscious suffering from gunshot wounds. Our partners at DC Fire and EMS determined the victim displayed no signs consistent with life, and he was pronounced dead on the scene. The decedent was identified as 18-year-old Antoine Roach of Southeast D.C. At the time of his death, he was in possession of a loaded illegal firearm. We'll be releasing an image of a vehicle shortly. This is a vehicle of interest in this case, and we would appreciate the community's assistance in identifying the whereabouts of that car or any information relevant to this incident. On Saturday, May 23rd, officers from the 7th District were flagged down in reference to a shooting in the 1600 block of Savannah Street Southeast. This occurred a little bit before 8 p.m. They located an unconscious adult female suffering from a gunshot wound. She was transported to an area hospital where medical staff pronounced her dead. She's been identified as 71-year-old Sheila Lucas of Southeast Washington, D.C. I've learned that Miss Lucas has raised a large family on her own, previously worked as an assistant nurse, and was a great-grandmother. She tragically lost her life trying to break up a dispute that involved one of her granddaughters. There was a second victim from this incident, an adult male that sustained non-life-threatening injuries as a result of a gunshot wound. We're going to continue to ask the community's assistance with this case. We understand that there were several witnesses out there at the time, and anyone that has information, we'd ask them to step forward. On Sunday, May 24th, a little bit before 1:30 a.m., members of the 7th District responded to the 1800 block of Gainesville Street Southeast following multiple gunshots that were detected through our shot spotter system. When the officers arrived, they found an adult male lying in the parking lot of a residential complex suffering from multiple gunshot wounds. 26-year-old Kayon Kinney of Southeast D.C. was pronounced. We're also asking for the public's assistance in help identifying the individual responsible for this murder. We believe that an argument preceded this event, and we believe this was over a petty dispute that resulted in this 26-year-old losing his life. Yesterday evening at about almost a little after 6:15 p.m., officers from the 3rd District heard gunshots in the area of the 1400 block of Fairmont Street Northwest. When they canvassed the area, 2 victims were located suffering from multiple gunshot wounds. D.C. Fire and EMS transported the first victim to a local hospital where he was pronounced by medical staff. The second victim is in very critical condition. The decedent in this case has been identified as 22-year-old Christopher Beckwith, Jr. of Northwest D.C. It's my understanding that the decedent was a recent graduate of Cardozo High School here in our community. We're currently seeking any information concerning this case as well, so please help us by providing information. You can do that either through our tip line at 202-727-9099, or you can text us at 50411. I will remind people that those calls and those text tips can remain anonymous if you so choose. Lastly, we're continuing to investigate a case in which a 4-year-old little girl suffered a significant injury as the result of a gunshot wound. Last night, a little bit before 8 p.m., members of the 7th District were dispatched to the 3000 block of 30th Street Southeast for the report of a shooting. When they got on the scene, they located the child inside of an apartment suffering from a gunshot wound. She was taken to a local hospital. She's been subsequently transferred to another hospital where she is fighting for her life at this time. The investigation revealed that another child was playing with a firearm inside of the residence, and we believe this led to an accidental discharge. Our thoughts and condolences are with this family and the friends and the victims in each of these cases from this weekend. We will continue to pursue leads and investigate each of these incidents until they're brought to closure. As a last reminder, we offer awards of up to $25,000 for information in any of our homicides. Despite these violent incidents, as you know, we have been monitoring crime very closely during the public health emergency, and we can report a drop in both violent and property crime year-to-date compared to last year. City property crimes are down 12% compared to last year. Much of that reduction is attributed to a 17% reduction in thefts. Violent crime across the city has decreased by 10%, including a 15% reduction in robberies. With regards to domestic violence, we've actually seen a slight decrease in both calls for service, incidents of domestic violence, and arrest, which are the 3 measures that we can measure at the police department. With that being said, I can turn it back over to the mayor for any questions that you all may have.
Thank you, Chief. Before I take questions, actually, let me just acknowledge Neil Albert, followed by Ms. Noel for any comments you might have to start about what's happening in your bid.
Thank you very much, Mayor Bowser. As you mentioned earlier, the bids and the main streets have been working with your DSLBD department to ensure that we can provide the care packages that you so generously made available to businesses that will be reopening in phase 1. So we welcome the opportunity to partner with you in this initiative. As Christy will point out later on, hopefully, we hope to have all of the mechanisms in place by this Friday so businesses could begin to receive those care packages. We want to emphasize that this is just for phase 1 businesses, but more information will be available on the mayor's coronavirus.dc.gov website. So thank you again for the opportunity to partner with you on this initiative.
Thank you. Thank you, Ms. Nolan.
And I'd like to thank you also. We are incredibly pleased that there'll be a testing site in Anacostia. Our community is very excited that this would be taking place, and we are anxious to help bring everyone together to move us further. I apologize. Move us further along with the fight against coronavirus. So the information I know is on coronavirus.dc.gov. We will make sure our community and our businesses are aware that they're able to access the public site. And we also are very excited that we will have the PPE for our businesses. We do a call every Wednesday that with our businesses, and they are very excited to be able to receive this and to be able to open up slowly but safely. So thank you again for the partnership, and we look forward to working with you more.
And thank you, and congratulations on the new opening in the Anacostia bid, Starbucks on Martin Luther King Avenue.
Yes, Starbucks is opened, and I hope all of you come by. They've got a great system set up so that they understand how important the safety is for social distancing, and the coffee is great, and the community is already enjoying it. So thank you again for bringing that amenity to Anacostia.
Thank you. And Christy, I know you'll help me answer questions about all the details. Thank you. Okay, any questions? Yes, Sam.
Question for the chief. The 71-year-old great-grandmother who was killed, is that linked to a brawl at the seafood counter in the Giant near where this happened? We saw on social media, etc. Is that connected, and are any charges coming forth because of that incident inside the store?
We believe that the original incident did occur inside of the store. The shooting obviously occurred a little bit down the block from there. We believe that the decedent, Ms. Lucas, was responding because one of her grandchildren was involved in that dispute. So we're obviously going to do everything we can. I'm absolutely sure that someone out there has information relative to what happened in the Giant and then afterwards. And so we're piecing that together. I'm hopeful that someone will come forward and give us some information so we can bring some closure to that family.
Specifically, charges for the incident within the store. I noticed there were a lot of police officers there in the video I saw, and a lot of, well, let's say, unruly people. Is there any charges going to happen as a result of what happened in the store?
It remains to be seen, Sam. You know, being unruly is not against the law. If there was some type of an assault or something that requires law enforcement intervention in the store, we will obviously take care of that.
Martin?
Yeah, just to get back to the date and what happened over the weekend, a lot of the reporters here were on the call with Dr. Nesbitt, kind of getting an explanation about what happened and also getting a crash course in how these things are measured from a health perspective. There's a lot of confusion out in the public about what numbers DC is using versus what numbers are publicized, and concerns that as we move towards reopening that the metrics are being met. You know, what could you say to residents who are concerned that, you know, they don't understand the numbers, they're concerned that DC isn't meeting its stated goals before it starts reopening?
Well, I can say I understand how somebody cannot understand some of these numbers because they're not numbers that we're typically using in day-to-day life. And we have a great team of epidemiologists who understand them very well and are reporting them out to us each day. The question, if I understand your question, is about the reset day.
No, more specifically, like, what would you say to residents who think, to be perfectly frank, that someone could be cooking the books? In Virginia, they mix two different types of tests to elevate their test levels.
Well, I'm the mayor of Washington, D.C., so I'm not going to comment on Virginia. I can tell you we have no interest in cooking the books. We have put out proactively a lot of information on a daily basis, and we will continue to do that. We are measuring a community spread. We recognized a day on Saturday, and we posted on Saturday that we thought this day and the data from that day had to be carefully looked at because it may establish a new peak, and it did. And what that meant was 2 days of progress where we thought we would be on day 13 on Saturday. We were actually on day 11. Since then, we have established 2 more days of decline, which puts us at day 13. Yes, sir.
Chief Newsham, you had a unfortunate incident that was also caught on video of one of your officers who was trying to, looks like, break up a basketball game, and he was hit in the face by someone who was willing to punch him. There was a scuffle. One of your officers, it looks like, tried to pepper spray the guy. I understand how you made an arrest, but can you just comment on that incident and what your officers are facing out there every day? And was this basically anger from the community towards these officers simply because they were trying to keep people from not social distancing?
Yeah, I wouldn't say any single incident that we watch, a snapshot of a video, is indicative of the relationship that the police have with our community. It's an unfortunate incident from the video that I've seen, that someone would strike one of our police officers, and the suspect in that case was taken into custody and will be held accountable. I don't know what his motive was for punching the officer. Our police officers have been asked to intervene in inappropriate social gatherings that go against the mayor's order, and we're going to continue to do that.
Can I follow up? Can you sort of give us a general idea on how people are reacting when your officers are asking people to break up groups, large groups?
It's hit or miss. Like I said, you can't characterize these interactions, generally as all being the same, because they're not. Most of the folks we come across are being very compliant with police orders, and then we have pockets of people who are not being compliant, and it requires a little bit more intervention by the police. So it's a mixed bag, I would say. And I've said this before, I think, this is very difficult for people to have to stay inside. This is a change for all of us. And I think by and large, if you take the 700,000 or so people that live in the District of Columbia, the large majority of those people have been compliant. And then for the people who aren't being compliant, I have to say, you see a police officer who gets punched in the face. Our police officers are willing to do that in order to ensure that everybody's safe during this public health emergency.
Still not given any citations for anyone who's refused to?
No, we have actually, I want to say the last time I looked, there's 5 or 6 across the city, which is, it's minimal that we've had. We will issue them if we have people that are being completely non-compliant. We are getting complaints from the community about large groups. Generally, when we go into these large groups, they will disperse. And then if they're not, then we'll issue the citations or make arrests if necessary.
And lastly, Mayor, you're very close to seeing a nice decline here, no deaths overnight. Do you feel now's the time that perhaps the police should maybe be a little bit more aggressive in keeping people from gathering in groups?
I leave policing to the police. You just heard from a 30-year police officer his best approach in working with his troops on enforcing the stay-at-home order in this case. And so I have great confidence in the police's ability to do that. And I saw that video, and it made me very angry that somebody, for a police officer who is just doing his job, to be hit, to be assaulted, from what I saw was a very respectful interaction. And just imagine how bad that could have gone. And so I think that our officers, from what I've seen, and I haven't heard any different from the police chief, followed their training, tried to de-escalate the situation, and anyone who is going to be willing to assault one of our officers is going to have to be dealt with. It's just that simple, and it's not worth it. Here you are playing a game, and now you're going to have to wake up in jail and whatever else happens. It's just not worth it. So we're all feeling anxious to get out and get back to life, but we have to listen to our officers. Yes, sir, Mr. Wright.
Two questions, Mayor. It's getting hot outside, so there's a good chance that we'll hit the high 90s or 100 at some point. Does your administration have a plan in terms of cooling centers? And if we have cooling centers under phase one?
We actually, Homeland Security gave me a briefing on their initial discussions about summer planning and heat emergency planning. And I don't have the details, but that operation is still working. So all of their summer planning and heat emergency planning is happening, and that's led by our team at Homeland Security.
My second question has to deal with the 4th of July. I don't know what 45 wants to do, but here in the district we have several parades in terms of, and you know this, Barracks Road, the famous Palisades Parade. And just to give clarification on this, as well as one downtown, clarification on this, under phase one, those activities will be suspended, am I correct?
We won't be issuing any permits for parades in phase one. Yes, ma'am.
You mentioned that the contact tracing, your new contact tracing hirees are starting on Monday. And a while back you said you were trying to get to 900. What's the timeline for hiring 900?
I said a tranche of our contract tracers was being hired today. We've been hiring in tranches for the last several weeks. And what was your question to get to?
What's the timeline for hiring the 900 contact tracers you said you wanted to hire?
Well, it will depend. So DOH will let us know when we need to bring on all of the numbers. I think where we'll be by June 1st is 200. We are also going to create a group of DC government workers that will be available throughout to flex up and flex down depending on the needs of the contact tracers. And we also we got a tremendous response to our contact tracing solicitation, and we can hire from that list as well. So it will depend on what DOH says our needs are.
This past weekend, I saw a lot of people gathering in Logan Circle, for example, and sitting in small groups, but there's a significant group of people sitting there. Is that something that you would say is allowed right now under the order, the stay-at-home order?
Where?
In Logan Circle?
On the circle?
Yeah, just sitting in small groups of people, but a lot of different small groups of people sitting in the circle.
Yes, you're allowed to sit in the park if you're social distancing. Yes.
I'm going to preempt this question by saying this has been asked before, and I know you don't like us asking questions that we've asked before, but the public is still confused on this one.
Okay.
So over the weekend, why was the spike in cases, why did that result in the city only losing a few days of the reopening after as opposed to starting back to the days here? Can you explain it in simple terms for the public?
Well, I'm going to explain it in simple terms because I'm not a statistician or epidemiologist, and they're not also many people listening aren't either. And DOH has explained that they look to 2 standard deviations over the rolling 5-day average to determine a peak. In a simple way that I explain it is the 5-day average is used because, as you have seen, daily, numbers go up and down. Symptom onset numbers also go up and down. And so they look to that calculation to determine what's significant or not, to determine a new peak. And there's a value associated with that depending on the points on the axis. And on Saturday, which were the Friday numbers, the value exceeded those 2 standard deviations. So what they did was go back to the day that was closest to that value. And that was the 11th day in decline, which was Thursday's numbers. And that's where they reset Saturday to. That's the reason.
So it seems like one of the big takeaways here is that it's okay to have one day that's worse than the other, but overall we're seeing an overall downward trend in students.
I would say basically yes, but not exactly yes. So I would refer to my previous description. Don't make me say it again. Not that, I'm annoyed by saying it again, but that's the reason. And I know you want to boil it down to simply speaking, I would agree with your assessment, but there could be something that changed it, as we saw over the weekend.
How does DC treat the positivity rate as a reopening metric right now? Because in some of the early days we were told under 10%. Over the weekend, Governor Ness said under 20% for phase 1 is okay.
Well, as you know, we have been reporting 4 metrics for phase 1 reopening. That's not to say that's the only thing that DC Health looks at. And I think DC Health would be very concerned if we had positivity over 20% in phase 1. In fact, I think it could. It's not where we would want to be. We want to see positivity going down, which is what we have seen. We also know that positivity rates are largely informed by how much asymptomatic testing you're doing. And as you know, we haven't been largely asymptomatic testing. And it is appropriate, in our view, that as we're reopening and more people are not staying at home and beginning to mix more, that we want as many people as possible to have access to testing because they're more exposed. We went from what to what, I'm sorry?
10% positivity rate to 20% positivity rate in phase 1.
We went from what to what?
So the metrics that DC government put out as of late April was we want to see below 10% positivity rate for phase 1. Now we're hearing below 20%. So what's the reason for that change? Based on your answer,
I don't know that there was a change, Fennett. I don't know that there was a change.
I'm looking at the PowerPoint slides from late April, and there it says we want to see a sustained decline in the positivity rate for 14 days and below. Well, at one point it said below 10%, another point it said below 5%. My point here is we're not sharing those numbers anymore. That we need to have a positivity rate below 10%.
Well, we've been sharing these numbers as phase 1 reopening metrics for a while, and that's been our focus. Yes.
Can you tell us why the move from United Medical Center over to Anacostia, and why the new testing? More importantly, why are you moving from there over to Anacostia? But then also why the Chinatown location was chosen for the other.
Well, I talked about that already, but we want a more accessible site in Ward 8 that's also close to the metro, that's close to the business district, that's more central to a residential area. So that's why we're there. We're going to be using a parking lot. There's space to walk up. There's space to drive up. There's space to metro as well. That's why. We are adding another centrally located location. I think that we're going to see more people opening up, more employees coming back to work. And we think that more people are going to want to avail themselves of testing. And so that is just another opportunity to do that. In addition, I don't think we have the map of all testing sites. In addition to all the other testing sites, and in addition to your ability to call your own doctor and go in for a test.
Can I ask a question of Mr. Albert? What is the sense that you're getting from your business community as to, I mean, I'm sure they want to reopen, obviously. They want to reopen, but what is your sense of how many of them will and won't reopen in phase one based on their own judgment of whether or not it's safe? Are you hearing from some businesses? If so, how many that are saying, you know what, even if the mayor gives us the green light, we're still going to wait and see?
So, as you know, I headed one of the mayor's sector committees for Reopen DC, the small business and retail sector, and so we talked to over 40 businesses. People are going to follow the guidance of the mayor and the health department is what we're hearing first. And then secondarily, people are going to be developing their sort of own guidelines based on the recommendations that came out of the mayor's report and her phasing for reopening. So when we talk to some property owners and office tenants, we're hearing that they're not going to come back to normalcy until there is a vaccine or there is some cure. And so that may be not until next year, but the retailers are more anxious to be open or have the capacity to provide services. And so the mayor's efforts to make sidewalks and other street infrastructure available for pickup and delivery will be important to the reopening efforts for downtown DC.
Back to our favorite topic, which is always data, and also I'm not a statistician, so I try to get through it every day, but have you guys also considered publicizing the exact numbers of community spread versus just the raw case counts? Because there are two separate buckets of numbers, and Dr. Nesbitt read them off the other day while reporters were only have access to the raw case counts. So have you thought about just making even more data public?
I'm looking at this graph because I think it shows this graph shows the points are related to symptom onset date in cases.
But have you thought about releasing the numbers the same way you guys do the daily raw case counts?
Those are the numbers that represented in that graph. I mean, what are you looking for that you don't have?
I mean, if you guys are running with a different set of numbers based on symptom onset, those numbers release the same way that you release the raw case counts, I suppose.
Oh, I see. It really is represented in the graph. I'm sorry?
They change too, Mayor.
Go ahead, John.
Sure. So the numbers you see in this graph, while they're in that gray shaded area, they change because it is a matter of the contact tracer getting in touch with the new infection. So when we made this chart available, we actually told members of the press that we wouldn't share the numbers that go with it because the numbers change based on the contact tracing of the new infections. But you can see on the chart itself, there's a range, and right now it seems we're in the range that's between 150, below 150, and slightly below 100. But what you'll see, because there's a lag, the days that are at the latter side, the right side of the chart, those will change as we get in touch with those who test positive, those new infections.
So is that lag ever long enough that suddenly you'd look back at day 7 and be like, oh my God, there's actually 50 additional cases based on symptom onset, or is it never that dramatic a jump?
That I would leave to the EPIs and to tell you, but remember that folks are asymptomatic, start showing symptoms generally 5 days or less after being infected.
Mark?
Chief, you spoke about specific cases. I'm wondering if you could speak in more general terms. In a typical year, we would have had a press conference about the summer crime initiative and, just overall your plan to attack crime in the city. what would you say to the residents, or what is your plan just overall as we see that, some violence and murders are still continuing? There still seems to be a problem with that in some respect. What is the plan for this summer just overall for crime?
So we did, Mark, I don't know if you noticed, we did roll out our summer crime initiative. We've identified 6 areas across the city which are most plagued with violent crime. One of the small differences in the summer crime initiative areas this year is our ability, obviously, to have community events, which we would normally have in those areas. Taking a look at the summer crime initiative areas right now, we have had some pretty good reductions in the areas that we've selected. We've got a long way to go. The Summer Crime Initiative lasts through the end of August. So we'll see how that goes. It's been very, very successful for about a decade, so we anticipate it will be successful again. And then when it comes to the violent crime, the shooting homicides in particular, we're going to continue to work removing these illegal firearms from the community and addressing the repeat violent offenders. If you look at the cases in recent days, last couple of months, they involve some career criminals that are involved in this behavior. So those are the folks that we're going to continue to target.
Chief, I see your commander of homicide is retired. Have you named a new one?
We have, he's the captain of homicide, Tony Haith. After 32 years of service to the Metropolitan Police Department and the residents of the District of Columbia, he retired this past week. Hats off to him and his family. He's a native Washingtonian who spent a lot of difficult days and nights trying to bring closure to people who lost loved ones to homicide in this city. The new captain assigned is a guy by the name of Carlos Harad. Carlos is a veteran person who has a lot of investigative experience. He was most recently assigned to the 7th District, and I think Carlos will he's got some big shoes to fill, but Carlos will do very well in that role.
Yes, Bennett.
Follow up on the question from Martin. So the D.C. government doesn't feel comfortable sharing the daily new cases by symptom onset date because of daily fluctuations. How can you feel confident saying there's 14 days of declining transmission tomorrow? You see that kind of day-to-day fluctuation.
I feel very confident in it.
So what happens if in a few days from now we discover there are more cases?
We could discover in a few days from now more cases. We can. That's what opening up means. You can discover in a few days more cases. If that's your question?
I'm saying for the 14-day period we're looking after reopening.
Uh-huh.
Let's say we go for it, your administration decides we hit that 14 days, we can begin phase 1 reopening on Friday. What if the data that comes in later this week shows that we actually have more of a rate spike at the end of that 14-day period?
I suppose that's possible, Fennett. I couldn't put a probability on it. I suppose that's possible. The 14 days are established as a metric to suggest that if there is increase in the next phase, that all of our systems would be able to accommodate that raise in the next phase. It's a shorthand. And we think it's a good shorthand because it's been nationally touted as the period of preparing for what could be increases in the next phase. So if you're asking me, is it possible that the interviews that the EPIs do looking back 14 days, we know that there will be increases. Will there be statistically significant increases that would produce a more than 2 standard deviation shift and a new peak? I don't know that. I suppose it's possible. I don't know how likely it would be. I don't know the answer to that, and I'm happy to have you talk to somebody. But it certainly makes sense, right? So if we want to see how the virus is circulating in our community, in settings where we don't have infection control. That's what we're showing. Yes.
Mayor Bowser, I don't recall recently any day when you said no deaths. How do you feel about that fact that you were able to say that today?
I feel good about it. I think when I heard it on my call this morning, I said amen to myself, or I may have said it out loud. But I also know that it's one day, and one day doesn't make a trend, and we're not done with it. And we're likely not done with fatalities related to COVID. Okay. Thank you, everybody.